Hi, everyone. This is Lynn Crawford with Hope Dementia Support, and I am here with you this evening with Willa Evans from the Agency on Aging and Disabilities, and she is going to talk to you about that port in the storm when your loved one has dementia. But first of all, I'm going to invite her to tell you a little bit about herself. And also, if you have questions, please go ahead and put them in the chat or in the Q&A, and we'll make sure that your questions get answered before we're finished this evening. So having said that, Willa, I'm turning it over to you.
Thanks so much, Lynn. As Lynn said, I'm Willa Evans. I'm a program coordinator at the Area Agency on Aging. And I came to work here after having taken care of my grandmother, who had Parkinson's and Parkinson's-related dementia, and also my great aunt, who was still very, very sharp, but was wheelchair bound. So I have some experience, about 5 years experience being a family caregiver and a helper to a primary family caregiver. And I have worked here at the agency for almost 11 years now. And I'm just really thrilled when I get an opportunity like this to share about our programs and services and what is available in the community. So thank you for having me, Lynn and Hope. And let me know when you would like me to start sharing my screen.
Sorry, I had muted myself. I'm ready whenever you are.
All right. And there we go. How's that? Okay. Well, as I said, I'm Willa with the Area Agency on Aging. And I am going to tell you, in case you don't know, a little bit about what an Area Agency on Aging is. There are actually over 600 area agencies on aging across the nation. They were established by the Older Americans Act quite a few decades ago. And they cover every county and parish in the entire country. So no matter where you go or where your family members are, you can direct them or yourself to an area agency on aging for assistance. Not all of them look quite the same. There are some differences in the services and programs each agency provides. But all of them operate to provide access to services for older adults and often adults with disabilities as well, in the home and in the community. Washington State has 13 AAAs, and locally our agency in Southwest Washington is your AAA, and we cover Clark, Cowlitz, Klickitat, Skamania, and Wahkiakum counties. So at AADSW, our mission is to promote independence, choice, well-being, and dignity for persons age 60 and over, adults with disabilities, and their families through a comprehensive, coordinated system of home and community-based services. And our vision is really that all of the folks in our community have access to information, programs, and services to help them thrive in the setting of their choice as they age. And a lot of people want to remain in their home. And so quite a number of our programs are designed around supporting folks to stay at home. So if you, AADSW is for people who are helping a friend or family member with personal care, transportation, appointments, or shopping. We call this a caregiver or a care partner. Not everyone sees themselves as a caregiver, but even if the help that a person is giving is medical appointment, transportation, then they are a partner in care with the person. AADSW was also for people who take care of the child of a family member. A lot of times this is a grandparent, not always. And that's how that program came to be housed here, because it is disproportionately grandparents. We're for people who wonder what to do if they or a loved one need care assistance and decide not to stay at home. You can give us a call and we'll tell you what your options are. or your loved one's options are for assisted living, adult family homes, and that sort of facility. We're also for people who want to relate better with a person with dementia if they're agitated, confused, or upset. So we offer training and other programs. We're also for people who wish someone could help them find answers to their questions, or honestly, even help them figure out what questions they need to be asking. A lot of times folks call us and they have questions, and it's only through talking with our specialists that they learn that they're not asking quite the right questions to get what they need. And they figure that out through calling us. And if you see yourself in any of these scenarios, or someone you know in one of these scenarios, then we may be able to help. And getting help starts at the Aging and Disability Resource Center. If you've been around Clark County for a while, you may have heard it called Information and Assistance or Information and Referral in the past. Names change as funding changes sometimes. So we are the Aging and Disability Resource Center for the 5 counties of Southwest Washington. And the ADRCs, as they're called, provide personalized assistance in navigating the range of available services and supports, and help folks to better understand the eligibility requirements and program applications that can often seem really overwhelming. And you can see here a sample of the services and supports that we provide, or that we provide referrals to. So our Aging and Disability Resource Specialists help people with everything from finding free tax help to health and wellness programs, senior oral health, dental programs, senior transportation. A lot of folks call and want to know where is their local food bank. All of these kind of questions are the questions our specialists can answer. But also, if someone is calling and wants help to apply for Medicaid long-term care in their home, they can help guide them through that sort of process as well. And the phone number is here on the bottom. It's also at the end of the presentation. So if you didn't get it jotted down, the very last slide will have it again. One of the programs that our ADRC refers folks to, I mentioned Medicaid long-term care. That's the long-term services and supports program. And at AAADSW, our focus is really on promoting that choice, flexibility, and community-based care over institutional care. If going into a facility is the best option for someone, we will absolutely help them with that. But we do work a lot with folks who, as I said, want to remain in their home. And we've been doing this for over 30 years, quite successfully now. We have over 4,500 clients on services today, with over $9 million in authorizations each month to help keep them in their home instead of being placed in a facility. And this allows seniors with care needs to stay home while saving tax dollars. If the state pays for someone to go into a facility, it actually costs about 3 times as much money as paying to get them care and assistance in their home. Now, long-term services and supports do have income and asset limits, and I'm not going to get specifically into those because I'm pretty sure that the state financial workers have crystal balls, and they put your finance information into that crystal ball and a number comes out. It can be actually quite confusing if you have any kind of investments and other things to figure out exactly what I can tell you will get you a certain amount of participation or no participation in paying for the service. So we encourage people to just go ahead and apply and start going through the process if they're even in the range of financial eligibility. So as I said, it does have income and assets limits, but it also has one thing that sometimes scares people is the state recovery and a possible copay that I mentioned. But knowledge is key. You can protect a lot of assets like your home or investments that you have by working with a lawyer who's knowledgeable about Medicaid financial planning. And you really want to make sure that you find one that is specifically experienced in Medicaid planning. And good news, the formula for calculating a possible copay changed 2 years ago, and now a lot fewer people who are applying end up having a copay. So it almost doubled the income limit for the program. We also have programs for those of you who are providing care to someone else. And one of those programs is the Aging Network program. This is a program for folks who might fall through the cracks if they lived somewhere else. Washington is great about making sure people are not falling through the cracks. And this program is designed for those who maybe make a little bit more money and have a little bit higher assets. And so they wouldn't qualify for Medicaid long-term care, but their care is enough that they need some help. And if they didn't get the help that they needed, they would end up in a worse situation more quickly. So this is to help people avoid getting on more expensive, longer-term services. And Aging Network program is for seniors age 60 or over who have medically necessary personal care needs, but don't have a friend or family member who are able and willing to meet those needs. So they may have family around, and that family may even be helping them, but it's not enough help to meet their basic care needs. And there are resource limits, but as I said, they're higher for unmarried people than in Medicaid. And the participation may apply based on income, but there is no estate recovery. So that's a draw to this program for some people. So I mentioned that we also support folks who are providing care for kids. Our kinship program is for grandparents, siblings, aunts, uncles, or other relatives who are raising a relative child aged 18 or under, whose parents are not living in the same home and are not consistently active as the primary caregiver to the child or children. And relatives both with or without a legal relationship to the child in their care may be eligible. And what I mean by that is you don't have to have a court order that says you have a right to be raising the child. You just have to be raising the child and have some way to prove that. A lot of times the schools will provide a letter saying that they know the child is living in your home, and that's sufficient. The only thing is there cannot be any DCYF, Department of Child, Youth and Family Services involvement in the situation. So the child cannot have a state caseworker. There's no cost involved in this program participating. There's no participation, there's no income limits. Excuse me, there are some income limits, but there's no participation and no cost. And services and supports can include all kinds of things from support groups to assisting with past due rent or utilities if there is threat of eviction or shut off, auto repairs, if the car is broken down and you can't get the child to medical appointments. Will even help pay for summer programs and school fees for participation in band or sports or those sorts of things. If you're supporting one or more adults, we have several programs as well. Two of them are very similar. They're called Medicaid Alternative Care and Tailored Supports for Older Adults, or MAC and TSOA. And MAC and TSOA brings supports and services to unpaid care partners who are helping someone 55 and older who meets specific daily care need requirements. And the financial requirements here are broader than in the Medicaid long-term care, and there is no estate recovery or copays. And TSOA is available both to those dyads, we call them dyads when you have an unpaid family or friend and someone who is receiving the help. But TSOA is also available to seniors who do not have anyone able to meet their care needs. In supporting one or more adults for caregivers, we also have our Family Caregiver Support Program, which is also for unpaid family and friend caregivers. And but this is a little broader. The previous programs, the care receiver had to be 55 or older. In our family caregiver support program, the person receiving care has to be 18 or older. And this has been a long-standing program with us. And there's no estate recovery involved at all. There may be a sliding fee for respite care, care in the home, depending on the income of the care receiver, but all other services are free of charge. And it's actually quite a broad range of incomes that will qualify for assistance. I believe the last time I looked at the chart, you had to make somewhere upwards of $6,000 a month before you had to pay 100%. Caregivers, we have these programs for caregivers because caregivers have a real positive impact in the lives of care receivers and on the state. There are over 850,000 family caregivers in the state of Washington, providing more than 80% of long-term care in the state. That's roughly equivalent to $10.6 billion of unpaid help per year, which is 5 times the amount of money the state spends on long-term care. So if even 1 in 5 caregivers gave up, it would double the cost to taxpayers to provide long-term support services. So while it is providing assistance to caregivers and care receivers, it is also of a benefit to the state and the taxpayers to help caregivers to be able to manage the tasks and the situations that they're in. And living here in Washington, you made the right choice. Washington ranks at the top in supports for family caregivers. Washington and Minnesota always are fighting for spot 1 and 2 as the best places to live as you age and to get support. And it shows 84% of caregivers who receive ongoing support through our caregiver support programs show significant improvements in overall health and well-being compared to caregivers who do not join the program. Services are tied to caregiver needs in this program, which is a little different than the others. And the others, they're based on the care receivers' daily activities of living and how those are impacted by whatever illness or situation that they find themselves in. But in the Family Caregiver Support Program, it's completely tied to the caregiver needs and related to things like the stress that they're feeling, the difficulty they're having going from being primarily feeling like they're in a spouse role to feeling like they're in a caretaker role, if they're struggling with depression or anxiety or other areas of stress. The Family Caregiver Support Program research around it shows 84% of those who participate show improvements in how they're feeling around those things and are able to take care of their loved one for a longer period of time. All 3 of these services, though there are some differences between them, do have similar components to them. So whether you're in any one of these 3 programs, you can find out information about other local services from your case manager. You can access caregiver skills training, dementia care education, and dementia supports, assistance for depression, grief, or stress. We can also help with purchases of adaptive equipment or supplies to make home care easier. We can pay for personal care services or respite care. And the difference between those 2 is one is for the Family Caregiver Support Program and the other is for MEC and TSOA, but they're the same thing. They are the in-home care where an agency provider comes into the home and maybe cleans, maybe provides a bath, cooks some meals, or whatever else is needed. We also offer referrals to support groups, home delivered meals, emergency response systems, and of course you get personalized case management. Some of the other programs I'll just go over briefly that we have and that we work with are senior nutrition. So these are the congregate meal sites that you may know about in the community, and also home delivered meals. And these are provided through the Meals on Wheels people, and that funding comes through our agency. We also do the senior farmers market vouchers. So if you want to know more about that, if you haven't heard about that, I'm happy to talk about that at the end. But that also comes through us. We also do Sheba and MIPA, which are through this statewide, it's the statewide health insurance benefits advisors. That's a mouthful, but basically they provide free unbiased information about Medicare coverage and access so that you can make informed decisions about your insurance needs. For instance, someone might call up and say, the insurance that I have under Medicare is not paying for this medication. Can you help me figure out which insurance company would pay for this medication? And then they would walk them through that. They would find them another insurance, and they would help them at the appropriate time of the year to change insurance companies so that their medications would be covered. We also do senior transportation for people age 60 and over who don't have access to a vehicle or unable to drive and can't use public transportation. We do provide some legal services through Northwest Justice Project. We also have our long-term care ombuds program. And these folks are highly trained volunteers who give a lot of their time and a lot of empathy to go into facilities and help residents with concerns that they have, advocate for their rights, and work to resolve any complaints that they have about how they're being treated or billing issues and things like that. We also have health and wellness programs. I mentioned senior oral health before, dental health. We have we fund programs in 2 local dental clinics to provide free dental care to low-income seniors who do not have health insurance with appropriate dental care. We also have programs like Enhanced Fitness, which you can see in the picture there, which are free exercise classes that are offered in Brush Prairie, Washougal, and Camas. And we have done fall prevention and emotional wellness programs. So we have a lot of programs. If you call the AAADRC, you're going to be referred to whichever programs you're interested in, or when they ask you the questions, they say, you know, you might be interested in this other program given the needs that you're telling me about. So they are the specialists, they are the most knowledgeable people in our agency, I think. Our case managers go to them and ask them questions all the time. So they're a really great source of information. If you are an internet user, we also have our webpage, which has a plethora of information and resources for seniors, people with disabilities, caregivers, and for healthcare service providers. And so if you go on our website, it will look something like this. It has scrolling pictures, so it doesn't always look exactly the same, but you can see there at the top, it has sections for you to click on if you're a senior, or you're an adult with a disability, you're a family caregiver, or you're a service provider. And when you click on those, then you will get more information about that specific topic. For instance, under caregiving, we have the active daily living guides, and we have a link to something called Trualta. And it is a website embedded within our website that has short little classes about different topics like hygiene and dressing, medication management, meal preparation, pain management, and various health conditions. So it's designed for family caregivers to learn more about their caregiving role. There's also a calendar of events on our page that will tell you about all of our upcoming educational opportunities, like caregiver education, support groups, dementia education, fall prevention, and others. So again, I said I'd put up the phone number. There it is. That's the phone number to call the Aging and Disability Resource Center and ask all the questions you might have, and get connected to any of the programs of or services I've covered today, along with any others. Just give our resource specialists a call. If you have any questions, let me stop sharing my screen here. Stop sharing. There it is.
I'm talking away and I am muted. So let me try that again.
Okay.
Who do we call for questions of community supports?
That would be the Aging and Disability Resource Center. And let me give you their phone number here. I will put it in the chat. Take me just a second here. Too many windows. There you go.
Thank you.
Hold on, I'm still trying to get it to paste.
Oh,
there we go. Thank you, Paula.
that was helpful. All right. So how do I know what programs I need? We hear this all the time. How do I know?
Well, you don't. That's where you don't always know. That's where I said sometimes you call and you find out not the answer to your questions, but which questions you need to be asking. And that's how you find the right programs. So when you call, basically the Aging and Disability Resource Specialist is going to ask you a series of questions. And they're going to start with some demographic questions, because as most people know, whenever you deal with government funding and private grant funding, they always want us to collect data about who you are and where you come from and all of that sort of thing. So they'll always ask you those questions. But then they will start asking you some questions about what's going on in your life, who are you taking care of, what conditions do they have, and trying to sort of suss out how much caregiving that you're having to do, whether or not you're feeling any burdens around that. And then they will start telling you about the programs. There's usually more than one program that might fit your situation. And so they'll tell you about what your options are, and hopefully give you enough information that you feel you're making an informed decision about the path that you're going to take. And if you're calling about other things other than care, other than getting care, maybe you're looking for dental services, maybe you're looking for mobile dental, maybe you're looking for where can I find assistance with getting some work done on my home, or someone to help me with yard care. They can also let you know that information as well. So it's not just about programs around caregiving.
So as a caregiver, am I the client or is my spouse the client?
Depends on the program.
And are there different programs for caregivers and care receivers?
So that's sort of a technical question, meaning on your end, it won't really matter who the client is. It matters on our end, on the funding end. But yes, we do have programs that are tailored to the caregiver. The Family Caregiver Support Program specifically is going to ask the family caregiver all about their stressors and the amount of time they're spending providing care and how they're feeling about that, and MAC and TSOA, the other two programs for caregiving dyads, are going to ask a little bit of those questions, but they're going to be more focused on the physical condition and the needs of the care receiver. But both people in both of those programs, both people are able to access services appropriate to them. So for instance, in family caregiver support, if you get respite care, that's a home care aide coming into your house to provide some assistance. We say that that is for the caregiver because we're giving the caregiver a break. If it's in MAC and TSOA, it's personal care for the care receiver because it's federal funding coming from the Centers for Medicare and Medicaid, and the care receiver is always the client. So as you can see, it's sort of arbitrary. The programs are for both people. We do what we can to provide supports to the caregiver so they can continue providing care. And that often looks like financial assistance for durable medical equipment that the care receiver is going to use, or in-home care, bathing assistance, laundry, house cleaning, that is going to be taking care of the care receiver. So the answer is one, the other, and both.
What's the best way for a medical professional to refer to the ADRC? Should you just provide the number, or can we submit a form for them and then you outreach?
So one thing I did not show you is something called Washington Community Living Connections. And Washington Community Living Connections is sort of a elaborate database of services that are available in the area that you live in that has been developed by the Aging and Long-Term Services Administration in the state of Washington. That's the long way to get to. There is actually an email referral for healthcare providers on that website. So if the provider goes to the Washington Community Living, CLC, Community Living Connections, they can click on I'm a provider and they can fill it out and refer a patient with the patient's permission. They're also just happy to give the client our phone number. We actually have a healthcare provider liaison who can go out to clinics and talk about our agency and work with them on setting up referral processes and that sort of thing as well.
So how do you get a case manager to assist with making decisions? Or do you have to be on long-term care Medicaid?
So can you give me a little bit more information on what you mean about assist with making decisions?
Stephanie, can you respond to that? And while she is responding, I have another question.
Sure.
So is qualification based on combined income and assets or individual, or does it matter?
Depends on the program. And that's why I always say call the ADRC and they're going to ask you all these questions, because basically you don't have to figure out which program is the right program. Your job is to answer the questions, and then the ADRS, the Aging and Disability Resource Specialist, will say, here's the 3 programs you appear to qualify for. Now you get to make a choice instead of here's the 15 programs that exist and you have to figure out all of the requirements for all of them. So for instance, TSOA is based on the income of the care receiver. Family caregiver support doesn't have an income limit, but if there's a copay, it's based on the care receiver. If you're getting Aging Network program, whoever is getting the help, if they are married, we look at joint income. So when you call, all of these questions are going to be asked about your finances and that sort of thing so that they can whittle down to the core programs that would be appropriate for you.
So the website can be confusing. What is the best way to find out about all of these programs that are offered?
Calling again, it's if you're looking for care in the home, assistance with being a caregiver, the best thing you can do is call the Aging and Disability Resource Center and let them ask you their list of questions and tell you what's available to you. Because some of these programs, they have very similar but important, very similar criteria, but very important differences between them. You know, for instance, where MAC and TSOA, you have to be 55 or older, but family caregiver, you only have to be 18 or older. So if you had to keep all that straight, it would be an awful lot of information. But the specialists, that's their job.
We've had a couple of our HOPE participants tell us that they have called and that the response has been that they do not qualify, basically for anything.
I would have to talk to the specific person who had that situation, and because I can't know just from that statement why that may have been said.
Is that ever possible?
If you identify yourself as a primary caregiver who has a level of stress around providing care, we have some level of assistance.
And
If you call and you say, I want to join the family caregiver program because I want respite and I take care of my mother and she makes $12,000 a month, then they're going to say you don't qualify for that program.
Okay. So going back to that previous question, asking for case manager to assist with some of the paperwork and meet in person to help with getting to some of these programs.
Okay, so when you call the Aging and Disability Resource Center and they ask you all these questions and they tell you about the programs, and they'll even send you some stuff in the mail if you want to read something about it. And then you make a decision, or they say this is the only program, and you say, okay, I want that program. Then they're going to provide a referral to our case managers, and you're going to get a phone call from the case manager who's going to talk to you some more about the program, and they're going to make an appointment to come out and talk to you and do a screening assessment. And at that screening assessment, they're going to figure out that you do qualify for the program. It's very rare that a referral gets to a case manager and the person does not actually qualify. So I want to put that out there. Our Aging and Disability Resource Specialists are very good about picking the program that's appropriate for the person. So yes, a case manager can help with the entire process. Our programs don't have, well, the family caregiver support has very little paperwork involved. MAC and TSOA, the other two programs for caregiver care receiver dyads, do have some financial paperwork that you need to take care of. You'll have to prove income and that sort of thing. And that is actually done with a state financial worker. So you will be assigned a financial worker who will let you know exactly what they need from you and when they need it by. And if you have questions, you can call your case manager depending on the questions. They don't always, because it's finances, they don't always know the answer, and they may refer you back to Home and Community Service financial worker. But it's not as daunting as it sounds. Usually all they're looking for is proof of income, proof of the value. Well, they look at tax rolls for proof of the value of your home, because some of the programs, your home can only be worth up to a certain limit. They want bank statements or tax statements, that sort of thing. So it's usually paperwork that you have. And if you need to apply, if you need to fill out the application for MAC and TSOA, yes, our Aging and Disability Resource Specialists can assist you over the phone with that.
Change the subject for a second. Explain more about emergency response devices and programs.
So the programs that offer emergency response, so some of our programs are what I would kind of say they're like a prepaid debit card. So you get a set amount of money, and how you want to spend that set amount of money, you tell your case manager, spend this much money on, I want this many hours of care, and I want a personal emergency response system, and I want home delivered meals. And the case manager says, well, that's going to put you a little bit over your budget. Let's look at this. And so it's a budget sort of thing, and you figure it out. Some of the programs and that's Macintosh SOA. Other programs, you get a separate budget for personal care and a separate budget for what we call supplemental. So you would be able to get care in the home, and then with your supplemental budget, you could pay for PERS. Personal emergency response systems, we have about 8 contracted companies with various services, everything from a straight, flat, I've fallen and I can't get up, push the button, all the way to perimeter identification, which would be you can set a perimeter around your home, and if the person walks outside that perimeter, the company is notified and they call the emergency contact. So there's a great range of services, and if you happen to live in an area of our county that doesn't have great cell reception, some of these systems run off the cell towers, but others run off of the hard wiring phone wires in your home, and you do not have to have actual phone service as long as you have the wiring. Does that answer your question?
Besides the emergency stuff, is there DME that people can get through AAADSW?
Yes. So our Family Caregivers Support Program, NMAC, and TSOA, which are the programs for dyads, all have some way that you can access personal care supplies, like incontinence supplies, like Depends, durable medical equipment, PERS units, counseling services, all sorts of what we call supplemental services.
And is that based on your ability to pay?
No, in the Family Caregiver Support Program, if you are in the program and if you're fully in the program, there's actually 3 levels of Family Caregiver Support Program. So if you're having stressors and burdens around providing care, you're going to be at level 3. And if you're and the vast majority of our clients are at level 3. And if you're at level 3, then you get your budget is a budget for, you get 20 hours a month of in-home care, up to 20 hours a month of in-home care, which there may be a participation for, but as I said, you have to make the person who's receiving care has to make something upwards of $7,000 a month before they're paying 100%. Then you also get a budget. I'm not going to quote a number because it's been 4 years since I was actually a case manager for Family Caregiver Support. So I don't know that if they have changed the budget, but it used to be $1,200 a year to spend on all of those supplemental services that I mentioned, like incontinence supplies, durable medical equipment, and that sort of thing.
Okay. Do you help if someone doesn't have a power of attorney by helping with gaining guardianship or anything along those lines? The legal aspects.
Okay, so I'm going to ask a couple questions. So are you talking in this situation where you have a caregiver care receiver relationship, but there is no durable power of attorney in place, and you're trying to get guardianship of the care receiver? Am I understanding that correctly?
That question comes from Paula. So Paula, we would ask you to clarify that. And in the meantime, another question, does AADSW help with housing or finding housing?
So if someone is looking for a placement, like in an adult family home or assisted living, the case manager can provide them with lists of based on their criteria, or can direct them, if they are tech savvy, can direct them to the website that lists all the adult family homes. If you're talking about, say, a lower income person who is struggling with housing and needs new housing, we are in partnership with the Vancouver Housing Authority, and there's really honestly nothing anyone but them can do about low income housing in Clark County, unfortunately. And so we direct folks to Vancouver Housing if that's the situation. But if you're talking about an individual, say an older individual who's in their own home and has decided that it's too much for them and they're ready to go to assisted living, or they're ready to go to an adult family home, then yes, their case manager would assist them in some way with that process if they didn't have someone else to do that.
Okay. And then going back to Paula's question, the clarification, and to remind everybody, it is, this is tricky. Do you help if someone does not have a POA or family by helping with gaining guardianship? And then she goes on to say that this is in all of the situations. I have patients that are diagnosed with dementia, but do not have anyone to be the decision maker for them and would eventually require a guardian.
You know, I have been saying for about 10 years now that this is a nonprofit we need to start. Because the answer to that is you can apply for a guardian ad litem through the state, but those are a little bit limited in numbers. And you can also make a referral or a report to the state saying that you believe someone needs a guardian, and it will be looked into to see whether or not the person is competent to be providing their own care. It's very, very difficult. If someone does not want a guardian, it's very difficult to get one in place. So that is something that is way beyond the scope of our case manager's capabilities, because it involves a lot of legal wrangling that our folks are just not, it's not in their scope of work. But there are there is a way to go through the state and do that. I recommend the website washingtonlawhelp.org, washingtonlawhelp.org. And there's information in there about everything from conservatorships, guardianships, other protective orders. There's information in there about how to establish a power of attorney, although I recommend you go to Lynn's presentation if you want to do that on advanced care planning and learn about advanced care planning. And I believe you have a lawyer who comes and speaks about some of these other things. And so I highly recommend attending those sessions as well. But Washington Law Help is a really good source of information. And like I said, it has everything from doing a power of attorney to a guardianship to what to know if you've applied for Medicaid long-term care and you want to know how they figure out how many hours you're going to get. There's actually a document there that explains it. So it's a really great website.
So going along with this, if your case managers are aware of an unsafe situation, either in a home that, a private home, or in an adult family home, or the situations that the long-term care ombudsman deal with?
Mhm.
How do they deal with that? Do they pass that information on? Do they recommend that you go on to do a referral?
Everyone at our agency is a state mandatory reporter. Anytime that we suspect that there is any kind of exploitation, neglect, or abuse, we are required by law to report it immediately as is safe for us to do so. And so it is immediately reported to Adult Protective Services. If there is a situation that is a growing situation and we're concerned, but it's not immediate, our case managers do have some training around how to talk to people about what their options are. For instance, you have a person living alone and they're having issues taking care of themselves, and it's not reached the point of danger, but it's not a great situation. Then they would start talking to that person and trying to coach them a little bit around their limitations and when would they want to make the decision that living at home was no longer a viable option. And then if it got to the point where it actually could be a harm to them, then there would be a report made.
Thank you.
Mhm.
So we have a person who says that they've made several phone calls to the ADRC and never been offered a case manager or a financial consultant. And it was only mentioned if they were on long-term care or Medicaid.
Right. So the financial worker comes into play when you actually apply for MAC to SOA or Medicaid long-term care. Once you actually apply for those programs, then you'll be assigned a financial worker whose job it is to determine your financial eligibility. So their job is to gather all the information that you send them about your finances and determine whether or not you meet the income and asset restrictions of those programs. So you wouldn't be offered a financial worker. It would be after you had already applied, you would be assigned one by the state. And you would be offered case management if you were asking about caregiver programs and you chose a program and you received a referral for the program, then your name would be given to the case management department and a case manager would call you. So I don't know the specific situation or questions that you were asking or what your conversations with them were about, but they're generally offering resources that seem appropriate to the situation you're describing to them. If you feel that that is not the experience that you have had, I highly recommend giving me or our agency a call and letting us know where we can improve.
If I had something going on and I felt strongly that I needed a case manager, is AADSW the place to go?
So if you were feeling like you needed assistance with some activity of daily living, then calling our Aging and Disability Resource Center would be the place to start, and to explain your situation to them so that they could look and see if there were any programs that you qualified for.
So what if you've been told that you don't qualify? Should you try again?
I'm going to say based on the questions, some of the other questions that were asked here, if you are on this Zoom meeting and you have called and been told that you don't qualify for anything and you're a family caregiver, I would love to hear from you. and either help you understand why that was the situation, or figure out that that shouldn't have been what you were told. Because, you know, when we're on the phone and we're trying to collect information, we don't always get every single little piece that we need to make the best decision, although the vast majority of the time, our folks are very competent folks. So, but there's always room for error. And I would just want to look and make sure that the reason, I would have to look at the notes and look for the reason why the specialist told you that you didn't qualify.
Once a case manager has been assigned, do they always come out to the house to talk with you?
The state requires home visits. So yes, there has to be a home visit. The home visits can vary in length. We do have some folks who prefer not to have very many home visits or have people in their home. So in a couple of our programs, we do have the leeway to do the assessment over the phone. And then the case manager goes out and meets with the client, say for 10 minutes, signs all the paperwork that needs signed, and gathers any paperwork that needs gathered. And that's the extent of the home visit. We do have programs where home visits are mandatory by the state or the federal regulations. And in order to participate in the program, you have to be willing to allow a case manager to come to your home.
Okay.
And that's not an us rule. That's a federal rule. Those are usually federal rules.
Can you tell us a little bit about the workshops that are available for people? It's kind of like those are pretty awesome, and yet people don't know about them.
Sure. So a couple of the workshops that we do, there is a managing your medicine cabinet, which is about prescription medications and how to work with your doctor and your pharmacist and make sure that that you're being safe. For instance, it's shown that every additional medication that you're taking, I don't want to say geometrically isn't the right word, but it increases your risk of adverse effects. So it doesn't just raise it that, like if you have 4 and you get a 5th, it doesn't just raise it like 1 out of 5, it like raises it like 2 or 3 out of 5 risk for adverse effects. So this class talks about how to talk to your doctor and your pharmacist, or especially if you have multiple doctors and they don't all know exactly what you're taking, to make sure that you're not over medicating, to make sure what do you do with meds that you want to get rid of, that sort of thing. So it covers all these topics. We also have a class that we offer just once a year called Emotional Wellness. And it is exactly what it sounds like: how to be emotionally well, how to deal with stress, how to be in the moment, how to combat sadness, grief, how to work through grief, all of those sorts of things. We also have, we've just changed our education schedule. So I'm thinking we have some programs there's some classes that are part of our programs. For instance, in family caregiver support, you can access a class called Star C. It's a one-on-one class for 6 weeks, once a week for 6 weeks. And it is designed to help a caregiver work through and work with difficult behaviors with their care receiver with dementia. It's a fantastic class. I taught it for a couple of years, and I actually used it in all sorts of situations, from work to my personal life, with folks who didn't have dementia. So it's very effective on how to get a different outcome, a different behavior. And that's a fantastic class. Like I said, we just changed our class schedule. We're rearranging it, and we're looking at some other classes around aging well. So I also can recommend, if you want to be involved in some sort of educational experience for senior population, there's an organization called Senior Planet, and it is now partnered with AARP, and they have Zoom classes, everything from fitness to book clubs to travel clubs. They even do seniors and dating classes on seniors and using dating apps. They do tech classes. So they are a resource that we let people know about when they call for information as well.
Can you describe powerful tools?
Oh yes, powerful tools. How could I forget powerful tools? So we have powerful tools for caregivers of adults and powerful tools for kinship caregivers. And powerful tools is a fantastic class that meets for 6 weeks. And it's basically how to take care of yourself when you're caring for someone else, because the biggest challenge when providing care is burnout. And we find that caregivers end up not taking care of their own emotional needs, their own medical needs, their need for sleep, all of that sort of thing. So Powerful Tools gives them the tools to manage their stress, communicate with family members. We call them the fly-in sisters who think nothing's wrong with mom. I don't know why you're always telling me all these challenges you're having taking care of mom, but they only see mom when they drive down from Seattle and stay for half a day, and mom's in a great mood because they get to see them. So how do you have the conversations with that person? How do you deal with conflicting thoughts that you have around providing care, that you love this person and you really want to care for them and be there for them, and at the same time maybe you have developed a little bit of resentment, or maybe you're just snappy because you're so tired all the time, and so how do you manage those emotions, that sort of thing. Powerful Tools covers the gamut of all of the stressors in a caregiver's life.
So are the classes that we've been discussing available to everyone? Or do they have to be already established with the Agency on Aging in some fashion?
That's an excellent question. So a class like STAR-C, which is the dementia behaviors class, you have to be part of the family caregiver support program. But the vast majority the vast majority of our classes are open to the entire community. So you can take Powerful Tools, you can take the medicine cabinet, you can take emotional wellness, if we do a fall prevention presentation, all of those presentations are open to the entire community. They are advertised in the Messenger, and they are also advertised on our Facebook page.
Well, as you know, we have quite a number of support groups.
Yes.
If we had a support group that said, gee, this is so much, I just can't deal with it, could somebody come and talk to us? Would we be able to have someone come and talk to a group specifically?
Very possible, yes. If you had a group and you wanted a specific topic that we could talk about, it's likely that we might be able to do that. If you're talking about from an education perspective, if you're talking about from understanding what programs and services there are available, we could absolutely see about having somebody come out.
Okay. Well, I have this very nice note here that said that this is a very clear rundown on the very comprehensive programs that the state of Washington has put together for people in these situations. We moved here from another state, and this is far and above what was available there. Thank you so much.
Well, you're very welcome.
I have to tell you that I've heard that over and over and over again, so it must be true.
I am doing my best to drag my parents kicking and screaming to the state of Washington because it is an excellent place to age in place. It always #1 or #2 in the country for aging services.
Pretty awesome.
Yeah.
So does anyone have any other questions for Willa after she's worked all day? We're so appreciative that you're doing this for us. If something comes up that you think of and you didn't ask, feel free to call the ADRC
Yes.
because they will be happy to provide that information. And if you don't mind sending me your slides, I will send them out.
Mm-hmm.
And then this session is recorded and people will have the ability to watch it on our YouTube channel. So we have that, and then our education for the month of July, and I believe that you mentioned this a time or two, has to do with fall risk and fall prevention. And it is by a local occupational therapist who has worked in home health for a long time, Sue Doyle, and then by Sam Lewis, of course, from Clark County Fire and Rescue. So that's another good one coming up. So thank you all for attending on this very warm June evening. And thank you, Willa, for being here for us. We appreciate it.
Thanks for having me.
All right. Thank you all.